Hello, welcome to the University of Kansas Medical Center, and thank you for choosing the KUMC Rhinology team for your care. This brief video will go over the basics of your surgery, and we will discuss the risks, benefits, and alternatives to surgery. Endoscopic sinus surgery is done entirely through the nose. There are no incisions or stitches. We use small, specially designed telescopes, cameras, and other instruments to operate on your sinuses from inside your nasal cavity. There are 4 sinuses on each side: the maxillary sinus behind your cheekbones, the ethmoid sinuses next to the eye, the sphenoid sinuses deep within the nose, and the frontal sinuses in your forehead. Normal sinuses should just contain air. You can think of them as a room inside your nose. People with sinus disease often have mucus, inflammation, and sometimes pus and infection in these rooms. Because of this, the doors to these sinuses are often swollen shut. The goal of sinus surgery is to find and open the door and make the doorway itself bigger so that the sinuses can drain properly. Absorbable packing materials will be placed inside the nose at the completion of surgery to help prevent bleeding and to make sure things heal well. Your body will absorb some of the packing, and the rest your doctor will remove in the office. The benefit of sinus surgery for patients with chronic sinusitis is improvement in symptoms such as decreasing drainage and facial pain and pressure, improving nasal breathing and congestion, and improving your ability to smell and taste food. Additionally, once the sinuses are open, topical medications and saltwater rinses are better able to reach where they need to go and do their job to help keep your nose healthy. Sinus surgery is safe, but just like any surgery, it does have risks. It is completely normal to have some bloody drainage after surgery. 1 to 3% of patients will have a significant nosebleed requiring nasal packing or cauterization to control the bleeding. Infection is uncommon after surgery and can be treated with antibiotics by mouth or placed into your irrigations. It's important to know that your sinuses are in what we call a high real estate area, and this is because they sit next to the eye and beneath the bony base of the skull that separates the nasal cavity from the brain. It is very uncommon to have issues with the eye, but blurry vision, double vision, and visual loss are reported complications from sinus surgery. An injury to the base of the skull is also uncommon, but could cause a leakage of brain fluid, cerebrospinal fluid, from around your brain into your nose. If identified at the time of surgery, this can be repaired using tissues inside the nose. The alternative to sinus surgery is to continue and try to treat your sinus disease with medications like topical nasal steroid sprays, oral steroids, oral antibiotics, topical antibiotics, and saline irrigations. Sinus surgery is usually recommended only after these medications have failed to adequately control symptoms. Thank you for watching this video. We now invite you to ask any additional questions you may have regarding the surgery, risks, benefits, and alternatives.